8 factors that influence a baby's appearance. What happens during pregnancy can also influence a baby's health and look. Genetics isn't the only thing that defines a baby's physical attributes. There are many surprising aspects that can affect the growth and development of babies, ranging from the meals consumed by expectant mothers to the parameters of the environment in which they find themselves. 8 factors that may or may not have an impact on a baby's physical traits, even if we aren't aware of it. According to one study, babies born in the summer had higher average birth weights and adult heights than those born during the cooler seasons. The traits of newborns born in the winter, on the other hand, were the polar opposite. Sun exposure, which occurs largely in the summer, has been discovered to be a strong source of vitamin D, which is required for embryonic growth. Vitamin D aids bone formation by aiding calcium and phosphorus absorption, which has a good impact on a child's weight and height. Although desires are totally normal during pregnancy, avoid eating too many sweets to avoid the baby becoming overweight. Increased blood sugar levels during pregnancy, known as gestational diabetes, can harm the fetus, which relies on you for nutrition. The excess sugar can be stored as fat in the newborn, increasing the risk of obesity, diabetes, and jaundice, a treatable condition that causes the skin to turn a little yellow. Experts advise that gestational diabetes be managed with diet and exercise, or in severe cases, insulin or medication. However, for optimal therapy, it is always better to speak with your doctor or contact a professional. There is a myth that drinking milk will make your baby's skin whiter. Although there is no scientific evidence to prove it, what some studies have established is a link between milk consumption and healthy birth weight. According to a medical journal, women who drank only 1 cup of milk, or less, a day gave birth to smaller babies than those who consumed more. Each additional cup increased the baby's weight by 41 grams. The American College of Obstetricians and Gynecologists, ACOG, recommends that pregnant women consume less than 200 milligrams of coffee per day, as caffeine is rapidly absorbed and passes into the placenta. If ingested in excess, it can affect the growth of the fetus and, as a result, the newborn will have a low birth weight. 5. Eating peanuts during pregnancy. It has been suggested that eating peanuts during pregnancy, provided the mother-to-be is not allergic, may reduce the chances of the baby developing a peanut allergy. Allergic reactions may cause hives, redness or swelling. Other non-visible symptoms include digestive problems, difficulty breathing and increased mucus. If there is early exposure to this type of food, the baby can be protected from these symptoms. 6. Air quality. Air pollution can affect a baby's birth weight. According to experts, for every increase of 10 micrograms of pollution per cubic meter of air, the average mass of the baby at birth decreases by 8.9 grams. To try to counteract the effects of air pollution, pregnant women are advised to consume foods rich in vitamins and antioxidants. 7. Protein-rich food promotes hair growth. The baby's hair begins to grow inside the uterus in the 14th or 15th week. Protein not only helps your hair grow, but also your baby's. Eggs are a great source of protein. Eggs are a great source of protein and, in addition, biotin, which also stimulates hair growth. Other beneficial foods are spinach, rich in folate, iron and vitamins A and C, which help keep hair healthy and the scalp hydrated, avocados and nuts, which help combat hair loss. Oily fish is also a good source of omega-3 fatty acids, but pregnant women are advised to consult their gynecologist first, as some types of fish should not be consumed during pregnancy. The moment when the umbilical cord is cut can influence the color of the newborn. One mother noticed that when her oldest son was born, the umbilical cord was cut right away and the baby looked blue at first and gradually turned pink. Then, when she had her daughter, she decided to keep the cord intact until it stopped beating. It took about 11 minutes, and the child's color was very, very pink. Science backs up this mother's observation by stating that delaying the cutting of the cord for 5 minutes helps transmit more iron to the baby, which can have a positive effect on the baby's brain structure. However, in some cases, it does need to be cut as soon as possible, for example, when there is hemorrhaging or in babies who need urgent medical attention. When you were pregnant, did you follow any advice that you knew would have a beneficial effect on your baby? What myths or beliefs about pregnancy are popular in your country?